health. And this session is about understanding the active aging mantra for a healthy retirement. And I'd like to welcome our first speaker in this category, which is Dr. Anoop Amarnath. Dr. Amarnath is chairman of Geriatric Medicine and heads the Internal Medicine Department at Manipal Hospitals, Bangalore. He also heads clinical research. Also is a part of Government of Karnataka's COVID Critical Care Support Group. And he's been on the government's Vision Group for Health and Task Force for Health. He did his master's from the Royal College of Physicians, London, worked in the UK for a long period of time, received his Geriatric Medicine specialty training from the Royal College of London, and then moved in 2010 to India after extensive practice in the UK. Welcome on your behalf, Dr. Amarnath, to the podium. All yours.
Good afternoon, everybody, and thanks Silver Talkies for hosting me here. And I've known the Silver Talkies team for quite a while now, for about 8-9 years, I suppose, right from the time my team was in Apollo Hospitals. So, and thanks for the wonderful introduction as well. So we have a common interest between us in terms of quizzing. So thanks once again, and I'll try and keep this brief. I know it's a Sunday afternoon, and when we were in college, there were certain parts of or certain subspecialties in health, in medicine. One was preventive medicine, and we used to use the preventive medicine textbooks as our sedatives. You read that 1 or 2 pages, you go to sleep. So I hope this is not like that. Also, this is about preventive geriatrics. And one of the themes about active aging of this today's topic, and from a hospital perspective, I think the theme of this talk is to how not to see you in the hospital. You may call it rich coming from a doctor, but I think that's the theme, how not to see you in the hospital. Because, we come in from a different perspective. We see people day in and day out. And then if you look at it from that perspective, the top 4 or 5 things which bring everyone, the elderly into the hospital. And then at least if you know what brings you into the hospital, there are a lot of things you can do to prevent seeing me at the hospital. Always welcome to see me on a social visit, but not on a professional basis. So we'll talk about preventive geriatrics, and as much as it's a science, it's an art as well. No 2 elderly people are the same, and no 2 elderly people respond the same to the same set of treatment that we give. So it's both an art and a science. But what we'll look at is some of the most common things that bring elderly people into the hospital. And one of the top 2 or 3 ones are infection, sepsis, and injuries. Psychological problems, dementia, age-related memory loss, those are also amongst the top 3 or 4. We'll also look at systemic diseases like diabetes, hypertension. And the reason we picked this up is because what was initially identified as disease which you saw with aging, you see that much more in the younger generation now. Around diabetes onset, you see it in the mid-30s and 40s. So by the time you're 60, you already have a 20-year experience with diabetes, and then a 20-year worth of damage to your organs with diabetes. We'll also look at risk of disability, but I think we'll stick to the 4 or 5 major things. And this is from our experiences of, when we get a call from the emergency department, or when we get a call from the admissions department, we know that, okay, these are the 4 or 5 main things that bring elderly people into the hospital. So if you're a bit aware of these things, it would prevent our meetings. Infection is definitely the topmost thing that brings elderly people into the hospital. And amongst these infections, there are 3 or 4 major components: urine, lung, bowel infections, and skin. In terms of lung, I don't need to talk about the last 2 years. We've been at the forefront of treating COVID. Unfortunately, a lot of elderly people didn't make it. But fortunately, I think we had one of the most fantastic outcome rates across India, to be honest. And a part of what we do as the COVID Critical Care Support Unit for the Government of Karnataka is the protocols that we follow at the hospitals are the same protocols that we followed at about 15 districts in Karnataka, which we took over for remote monitoring and remote patient management. And I'm extremely happy to share that Karnataka is one of the lowest mortality rates in COVID at sub 2%, which is 1.5%. And compare that... Thank you. And compare that to around 9 or 10%, even in some of the most advanced Western countries. So I think we need to understand that with aging, our immune system becomes a bit weak. Our ability to prevent infections, overcome infections is lessened. And the sooner we identify these infections, the better. And I'm hoping that all of you have had your second dose of vaccination at least, because we've seen a lot of elderly people being extremely reluctant for vaccinations for various reasons. But I'm hoping that at least if you haven't had your second dose of vaccine, at least 2 doses are the minimum. So what we'll look at is urinary infections. I think, again, this is something which is extremely common in both men and women. Women, because you have a shorter urethra, and post-menopause, the protection that you get with estrogen and progesterone hormones, that is reduced, and hence you're at a high risk of catching infections. And when men, of course, with aging, you have an increase in the prostate size, which prevents the urine from flowing out easily. There's a lot of retention of urine in the bladder that leads to more infection. So urine infections are extremely common in the elderly. And I think one of the things which we need to understand is that they may not present in the classical way. So you may not have a burning sensation in the urine or a fever, but some of the subtle signs, more frequently visiting the washroom, a subtle change in the color or smell of your urine, or in some elderly people, behavioral changes, suddenly becoming a bit disoriented and suddenly becoming, talking something irrelevant. Now, these are signs and symptoms of urinary infection that we need to keep a close watch on. As I said, very easy to identify, very easy to treat, and most importantly, easy to prevent. So one of the things which we keep telling most of the elderly people is that, especially when you're traveling, especially when you're using public washrooms, I think hygiene is very important, especially before you pass urine. After you pass urine, I'm sure most of you wash your hands and wash up your private parts, but then it's before that matters, because once you open the knob of the door and get inside, that's when you tend to pick up germs. So always carry your hand sanitizers and ensure that you wash your hands before you pass urine. And for the women, when you're using the public washrooms, ensure you have those sprays with you to sanitize the commode before you sit down. So I think preventing urine infection goes a long way in preventing hospitalizations, because this is extremely common that we see day in and day out at the hospital. A very overseen thing is skin infections, because with aging we lose skin integrity, you lose a subcutaneous layer of fat, and that becomes an easy entry point for bacteria into the body and the organ systems. So whenever you're having a bath, after you have your bath, just ensure that there aren't any small cuts or bruises. We tend to neglect that, because with aging what happens, our sensory perception goes down. And then it's important that we keep a close watch on the skin integrity. Any new boil, any new cut or a wound, I think it's very important that we keep a close tab on that one. So of course there are a lot more infections that we see, but this is kind of a 30,000 feet view of what you can do and what you need to be aware to prevent coming into hospitals. The second most important reason why elderly people come into hospital are injuries, and most specifically falls. This slide says a lot of things. After the age of 65, 1 in 3 people have a fall each year. After you reach the age of 70, 1 fall every 2 years, and post 80, the average rate of fall is 1 every year. So it is that common of elderly people falling. And unfortunately, it's, a fall is just a symptom of something more underlying. A lot of times, a fall may be a mechanical fall, you've slipped or tripped on something, but mostly it is something more which is going on inside. Either the sodium is low, you have an underlying infection, or, in one of my last few slides, I'll talk about medicines. A lot of, if I can have, a list of the medicines that the elderly people in this room are taking, I could probably open my own pharmacy and make a profit out of it. So it's polypharmacy, which is one of the reasons for the fall. And unfortunately, the consequences of fall, fall begets a fall, may have fractures, especially in the neck of femur, which is the hip bone, and they're bedbound for a long time. And very unfortunate cases when they fall and hit their head, a subdural hemorrhage, which is a bleeding in the brain. So that's another significant a negative outcome when you fall. So I think we have to be scrupulous about how we identify falls and prevent falls. Vision, hearing, perception of our surroundings, muscle weakness, balance, all these impact falls. So I think we'll have to ensure that all these potential hazards which cause falls, and these are broadly classified into extrinsic factors and intrinsic factors. So extrinsic factors are what you see in the environment. There's a high tendency of late at homes to have these granite floorings, those kind of things, wherein the risk of falls are very high. But I think both extrinsic and intrinsic are something which we need to keep a tab on. This is something which we do at the hospital, the fall risk assessment. So that gives us a better idea of what is the potential for an elderly person to have a fall. Very busy slide in detail. I think we'll skip it because it's more technical. But I think this is what we need to take home. How do you prevent falls? Because I know that it's one of the major reasons you come into hospital with. But what are the basic, 5 or 6 things that I need to be doing to prevent these falls? Bathrooms are the biggest culprit. Most of the falls, more than 50% who come into the hospital would have had a fall in the bathroom. So grab rails, lighting, ensuring that there's these non-skid surfaces. I think these are all the environmental changes that we need to be making once we age, because our ability to balance goes down as and when we age, and more so our reflex time is much longer. When we are young, our reflexes are very quick, so we tend to grab onto something and get back into our balance. But as and when we age, the reflex time goes down. So I think these are basic things that we could do. But most importantly, at the bottom there, we are not 40 anymore when we are 60. So the speed at which we used to walk shouldn't be the same. And especially when you stand up after sitting for a long time, or when you stand up first thing when you wake up in the morning, you need to give a little bit of time for the circulatory system to get going. And that's why we say that any positional change in the elderly, whether it's lying down to sitting, or sitting to standing, or standing to turning direction, has to happen slowly. So it's good to be in slow motion when you're elderly. It prevents a lot of things. Apart from the infection and falls, I think off late, what we are seeing, we used to see dementia, huge numbers in the Western population, but off late, I think, especially in the subcontinental population, we are seeing onset of dementia and progression of dementia in a huge scale. So it's probably a separate chapter in itself, so I think we'll try and skip that and then ensure that we just stick to the basics. So 4-5 common things that we can do to prevent dementia. Chronic diseases like diabetes, hypertension, cholesterol, those are things that we need to keep a very tight control on. And I think 2 things which would be there, I don't know whether you can see that, I'll put it up in another slide. Physical activity. Physical activity goes to a large extent in ensuring dementia is under control. And apart from physical activity, I think the last but one, if you can see that, maintain frequent social contact. I think the biggest thing what Silver Talkies is doing, if you take that, is to prevent dementia on a large scale. So I think a big shout out to Silver Talkies, because this is a medically proven thing that the more you interact socially, the better is it in terms of preventing dementia. So a lot of these things are simple things that you could do. And when you talk about systemic illnesses, as I said, there are things like diabetes, hypertension, thyroid, cardiac issues. So these are things which would need a regular screening and a regular management. So this is more from a medical perspective, but I think the thumb rule is that earlier the diagnosis, the better the management, the lesser the consequences. Now, I can't be in Bangalore and not talk about technology. And I can't, not correlate the brain to technology and the brain to the computer. So when I was talking about dementia, I think this is something which we really need to consider. The technology works like this. The brain also works like this. You have an input, you have processing and storage, and then you have an output. The reason I put this up is because when you're talking about dementia and prevention, when you choose certain activities, make sure that the activity has all these components. Now, I'll tell you why. If you're watching television, it has some amount of input, will have some amount of processing, but that's it. There's no output, unless you keep shouting at the screen and telling the protagonist what to do and what not to do. On the other hand, if you have the input component which is impaired, that is your hearing is impaired or your vision is impaired, that again has an impact on the storage and the output. So this entire thing, the input, processing, storage, and output has to work seamlessly. The simplest thing that you can do is have a daily conversation with your partner, with your family. So that has input, it has processing, it has output. So when I said the social connect, I think it goes a long way in satisfying this, saying that you have all three components and your brain will be as active as it needs to be. And finally, before I wind up, the first thing that, when we take the Hippocratic Oath, or now it's called the Charaka Oath, it's do no harm. And one thing which we commonly see, and this is one of the studies which we published at the British Renal Society, is about polypharmacy in the elderly, that is taking number of medicines. So what we found was that around 12 to 14% of the elderly have inappropriate medicines. Now the inappropriateness may be the dose, maybe the frequency, or maybe the medicine itself. So I think it's extremely important that on a regular basis you interact with your doctors and identify, do I really need to take all these medicines? And do these medicines interact with each other? So these are, some of the simple things that we can do: infection prevention, fall prevention, dementia prevention, polypharmacy prevention. And trust me, it goes a long way in preventing you meeting me officially. So, thanks for listening. I hope it was useful. Geriatrics is a big subject, and each one of these topics are big subjects in themselves. Difficult to cover, but I think I've kept to the gist of what I wanted to talk. And looking at all of you, I go back to what I'd said. Preventive medicine did put us to sleep. I hope we haven't done that today. So, thanks very much. Thank you.